cases as the state ramps up its testing capabilities. The health department says 463 more Minnesotans tested positive for the disease, a new one-day high. That brings the total number of positive cases to 4,600. Over the border in Wisconsin, Governor Tony Evers has ordered state agencies to reduce spending by 5%. Wisconsin is grappling with steep revenue drops as well due to the coronavirus pandemic. Evers earlier this month said the state could lose as much as $2 billion over the next year. Let's head over now to
Under
Governor
our
Evers
Safer at Home order, every business across our state can do things like deliveries, mails, curbside pickup, and curbside drop-off. So, for example, whether you're an upholsterer, a taxidermist, a dog groomer, or you rent recreational equipment like kayaks, paddle boats, or canoes, you'll be able to provide some of those services under the Safer at Home order. And yesterday, we announced that the Wisconsin Department of Natural Resources will be reopening 34 of our state parks, forests, and recreational areas that were closed earlier this month due to unprecedented crowds and out of an abundance of caution to protect public health. The First Lady and I are both very happy about this announcement. The decision to close some of our parks was a tough one for me personally, but it was the right thing to do at the time to keep people safe. Wisconsin was among 21 other states, including our neighbors in Ohio, Michigan, and Illinois, in making the decision to close some or even all state parks. But now we're able to turn the dial to reopen most of our parks. That's good news because outdoor recreation is important for both physical and mental health, and I know how important it is to Wisconsinites to get outside and enjoy Wisconsin's natural resources and spring weather. We want to be able to keep our parks open, so we still will need everyone to do their part by practicing social distancing and staying close to home and their community. You know, we get a lot of questions about what close to home means. This is a place where we need folks to use their best judgment with an eye towards being cautious. When you think about your community and where to travel for recreation, think about things like where your kids go to school, where you do your grocery shopping, and where your place of worship is. Then try to stay within these general areas. These kinds of common sense we must make in order to slow the spread of COVID-19. Between these measures and a few adjustments like closing one day a week for maintenance and reduced hours of operation, we should be able to get outside and enjoy our parks safely and respectfully. Hopefully the weather will start cooperating soon so folks can get outside and enjoy state parks starting this Friday, May 1st. Now, as we continue planning our next steps, it's not without some uncertainty. You've heard me say many times that this virus sets our timeline, and we have to approach this like turning a dial, not flipping a switch. Believe me, I understand that is a frustrating answer. Small businesses can't operate on hypotheticals. Workers can't pay their rent with a promise of a future economic recovery. There is nothing I would love more than to provide some certainty on when we can open up more of our economy. While we can't control this virus, we can control how the state responds to it. And what we need is a unified, bipartisan approach. I look to our neighbors in Ohio, where Democrats in the legislature are working with Republican Governor Mike DeWine, or to Minnesota, where Republicans in the legislature worked with Democratic Governor Tim Walz to pass multiple pieces of bipartisan legislation. So I know it's possible here in Wisconsin, but it takes the cooperation and a willingness to work together. Not a partisan lawsuit that puts people's lives at risk. Safer at Home is working. It is saving lives. It is the best and most effective tool we have to save lives and prevent our hospitals from being overrun. That is why my administration has asked the Wisconsin Supreme Court to toss the lawsuit that legislative Republicans filed to take away Safer at Home. Wisconsin's pandemic laws give DHS broad powers to implement all emergency measures necessary to control communicable diseases like the devastating one we are now faced with. Every other state has similar laws, which were passed in response to frequent outbreaks of communicable diseases in the early 20th century. Wisconsin is one of at least 42 states that have used these laws to quickly combat and contain COVID-19 with safer at-home measures. Instead of having Wisconsin quickly respond to the pandemic and to save lives, the Republican lawsuit asked the Wisconsin Supreme Court to block the safer at home and have DHS go through a lengthy administrative rulemaking process. Deadly viruses don't wait around while bureaucrats and politicians jump through procedural hoops. An effective response requires swift action by public health experts, which is why state law gives DHS the power to act quickly to stop the pandemic and save lives. I'm ready to put this silly lawsuit behind us and work together. I'm calling on Republicans to join me in doing what's right to ensure public safety. This virus has killed more than 300 of our family members, friends, and neighbors. Thousands more are sick. Tens of thousands are experiencing economic uncertainty. People in this state are scared, and they want us to do everything we can to keep them safe. No one understands this devastation and fear more than our healthcare workforce. I continue to be blown away by the response of our healthcare workers and caregivers, whether it's our public health workers on the front lines working to stop the spread of the disease, our medical lab professionals processing COVID-19 tests 24/7, or retired healthcare workers stepping up to volunteer. We are seeing folks serve a cause greater than themselves. I'm especially grateful for the selflessness, empathy, and sacrifice of our nurses. In these challenging and unprecedented times, nurses continue to rise to the occasion, providing comfort and care to those who are experiencing their darkest days. Given the danger of spreading COVID-19, patients are often isolated from their families and friends. Nurses might be the only people who have direct contact with a patient, making them a true lifeline for patients who are lonely, sick, and scared. Can't say enough to thank our nurses and the rest of our healthcare workforce for their willingness to heed the call of our families, neighbors, and communities during this crisis. We find hope, unity, and strength in your service. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like to let all of you hear directly from Sarah Shane, one of the nurses on the front lines of this crisis. Sarah?
Thank you. I'd like to share a little bit about what it feels like on a hospital unit caring for patients who have COVID. Being in the hospital on a unit caring for patients with COVID is incredibly isolating. It's very isolating first for the patients. These patients only see their nurse or nursing assistant for the most part because they're the only people generally who are entering their room. These staff members additionally are wearing significant amounts of PPE, so it's very challenging for the patients to even recognize the caregivers that are caring for them. They have no friends visiting, they have no family visiting, and their only contact with their family or friends is through a phone or a tablet. Some patients are here for a few days, and some are here for a few weeks, and they are isolated the entire time. We do that in an effort to protect the rest of the patients and our staff in the hospital so that the building remains safe for everybody who needs to be here, but it's very isolating for those patients. Additionally, it's isolating for our staff. The nurses and nursing assistants are generally the only ones going into these rooms of these patients. So they're doing all of the duties that they used to have support from other staff members to do, such as cleaning patient rooms, drawing labs, delivering food trays, for example. The stressors for these staff members are huge. Patients with COVID-19 can get sick very quickly. The nurses are trying to care for these patients while also going into the room as few times as possible. And they're not able to have the door open, so they can't see their patients from outside of the room. So they're not able to do the monitoring that they're used to be doing. The staff are also concerned about taking the virus home. They're taking off scrubs or any clothing that was worn to the hospital before they even enter their houses. They can't hug their kids as their kids run to them to give them a hug after their day of work. They have to head straight for the shower. That's very, very challenging. This has been going on for 6 weeks, and we don't have an end date right now, which is even more challenging for the staff. They've really risen to this challenge, but it is a challenge. stay at home because it feels so isolating. But this virus is very contagious, and it is so much more isolating being in the hospital. So we need to stay home to help stop the spread. Thank you for your support of healthcare workers. And now I'll send it back to Secretary Palm.
Thank you, Sarah. Good afternoon, everyone, and thanks again for joining us today. On Monday, we announced our new Badger Bounce Back dashboard to track our progress towards the Wisconsin gating criteria. We're dedicated to making policy decisions based on data and science and committed to sharing that data with you. And so here's where things stand today. We have 50 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 11,047 tests. We have 66,630 negative tests, which is an increase of 3,095 tests over yesterday. There are now 6,520 confirmed cases of COVID-19 in Wisconsin, which is an increase of 231 over yesterday. Our total deaths here in Wisconsin have now reached 308. These numbers give us a daily general snapshot of the state of COVID-19 in Wisconsin, but it is not detailed enough to really tell the story of the pandemic in our state. That is why we are announcing today a new data page on our website. This page is dedicated to tracking facility-based outbreaks and investigations here in Wisconsin. Let me be clear. Every positive test of COVID-19 begins a case investigation with contact tracing. However, positive tests can also trigger a facility-wide investigation depending on the location of those positive tests. For example, a single positive test in a long-term care facility, such as a nursing home, indicates the need for a facility-wide investigation. The same is true for 2 or more cases in a group housing facility such as a jail or a prison, or a healthcare facility such as a clinic or a dialysis center, a workplace such as a factory or another indoor space such as a child care center. Wisconsin currently has 187 facility-based outbreaks and investigations. 93 of these are in long-term care facilities, 48 in workplace settings, 25 in group housing, 11 in healthcare facilities, and 10 in other types of facility settings. The webpage we are launching today will break this data down by setting as well as by region. Tracking the prevalence and locations of outbreaks and investigations in Wisconsin is integral to our Badger Bounce Back plan. We want to share this information so that you can see the challenges facing our communities and our state as a whole and understand how that is informing our policy decisions. In addition to our public health challenges, we know there are economic hardships caused by the COVID-19 pandemic that have reduced access to nutritious food for families. During the school year, over 400,000 students in Wisconsin receive free or reduced price lunches. Because schools are currently closed, many of these students are unable to access that food. We know many districts and community organizations are working tirelessly to help get critical nutrition to these children, and we are happy to announce today that more help is available to these families. Through funding from the Federal Families First Coronavirus Response Act, DHS will provide over $140 million in food benefits for families with children who receive free or reduced price lunches during the normal school year. These funds will be available through the first part of June. Families already enrolled in state benefits will receive the funding on their Quest cards or a dedicated pandemic EBT card. Families whose children receive free or reduced price lunches but who are not enrolled in state benefits will need to apply separately. And we at DHS are partnering with the Department of Public Instruction to contact these families so they know that they are eligible. We know that students need nutritious food to learn, and while in-person schooling has stopped, learning has not, and that is why the pandemic EBT program is so important. The COVID-19 pandemic continues to challenge us as a state, and you, the residents of Wisconsin, continue to rise to that challenge. Thank you for all the work you are doing, staying safer at home, so that we can do the important work of bouncing back as a state.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter per media outlet. We'll begin today with Scott Bauer from the Associated Press. Scott?
Hi. Thanks for doing this call today. Governor, the May 12th special election's a couple weeks out. Can you give an update on where you stand with your comfort level with having that as is? Will you push for any changes? And related to that, do we have an updated number on how many cases were related to the April 7th election? And are we now past the point of really worrying about that, given how far out that is?
Somebody also have to answer that last question. The first question is the election date is May 12th. We've spent a lot of time communicating with municipal officials across the state of Wisconsin. We sent a letter to the Elections Board encouraging them to make sure that they're connecting with those folks to make sure that everything can happen in a safe and in a safe way.
But as to the number related to the April 7th election, we do have 52 folks in Wisconsin who reported who have tested positive for COVID-19 who were either a poll worker or voted in person on election day. As we've said all along, their exposure may have been from something else they did that day, but as we've been tracking this and folks have been answering this question, these 52 folks did indicate they were either a poll worker or voted in person on election day. We will continue for 30 days, so until May 7th, with that as part of the contact tracing interview, but believe that after the 30 days, it is not a necessary question related to April 7th anymore. And I suspect that the vast majority of the cases we will determine or that we will hear about from in-person voting have also already likely come to the surface.
And I think this is Ryan also doing one other thing just to add about that in terms of how the administration has been responding to this. Just like with the spring election, the State Emergency Operations Center is working very closely with the Wisconsin Elections Commission and clerks throughout the state in order to provide personal protective equipment for poll workers, provide tape to be able to demarcate how 6 feet between people showing up for in-person voting, providing cleaning supplies and other support. We're also, just like we did with the spring election, making sure that there's enough poll workers so that we don't have to have unnecessary consolidations at polls, which causes, more people to congregate in a single place. So, safety is definitely foremost at our mind with this, but I think by having additional time in order to prepare, working closely with the Wisconsin Elections Commission, as the governor indicated, being in close contact with them. And then also, as we said with the spring election, and it's very important here too, the safest way that people can vote is by absentee ballot, and they can request a ballot today by going to myvote.wi.gov and requesting their absentee ballot. And that's the best way that people can participate in our democracy. Folks up north can choose who represents them in the U.S. House of Representatives and do so in a safe manner.
Thank you, Scott. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking the call. Governor Evers, you announced a cut in state spending today that's kind of associated with the pandemic. Can you kind of just address the reasons behind that and just kind of address that cut?
Well, certainly, as other businesses and governments around the state, issues around revenue is very important, and so this is a first step. Since this pandemic started, we made some changes procedurally in state government around hiring and not hiring folks, and making sure that travel is restricted in the most significant way. And so these things are important. We think it's one of our ways to get to a better place financially. Cutting the operations budgets by 5% is approximately $70 million in savings, which is important for us as a government going forward.
Thank you, Casey. Now to either Danny or Emily from WKOW-TV in Madison. WKOW?
Hi, my question is for DHS. We are seeing more drive-through testing sites popping up across the state. For example, Sauk County today is testing the general public with anyone who has symptoms of COVID-19, or even if they just feel ill. When do you think this will be expanded, and what's preventing it from happening statewide?
So Emily, it is absolutely an important part of a testing strategy in which you're working to get community-wide testing at a rate that allows you to really understand the prevalence of the disease in the state of Wisconsin. So we've been working with a variety of local public health departments and health systems across the state to expand the number and the use of community testing sites, whether it's drive-through or otherwise, to increase, as we've expanded our guidelines for testing, we need to expand the options and the ways that people can get tested. And so we're anxious to see more of those across the state, and we are actively, as I mentioned, working with a number of counties and local public health and healthcare systems around the state to do more of this kind of testing.
Thank you, Emily. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Hi, I wanted to ask about the reductions in state spending as well. Do you, as the universities are doing some furloughs, do you anticipate doing furloughs at any point? And what do you think of the idea of freezing state spending in the next fiscal year as Voss has proposed?
I didn't quite catch the very end of that, Patrick, but I think you asked about how the budget looks next year, basically, and it's going to be difficult. Certainly, we're hopeful that the federal government will help us along with that, and they're considering it at this point in time. But we're not wasting time. We're taking care of what we can take care of now, and that's the operations piece of the budget. And going forward, we'll be continuing to make difficult decisions.
Thank you, Patrick. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. This question is for Secretary Palm. Secretary, near the time of the first safer at home order, you said DHS models predicted between 440 and 1,500 deaths by April 8th without Safer at Home. Safer at Home has been in place for a little bit over a month now, and our number of deaths is obviously significantly below that range. Mm-hmm. I'm curious, what do the DHS models say now about the range of number of deaths Wisconsin might see all told?
Mm-hmm. So I think, Ben, it's important. There are a couple of clarifications. I think one, we projected the 22,000 infections by April 8th, and that would result in 440 to 1,500 deaths. And those deaths would not necessarily occur by April 8th, right? Because those folks infected by then those deaths would ultimately come from those 22,000 infections. But I think, right, the bigger point is that Safer at Home was designed to never allow that to happen, which is why we believe that Safer at Home, this is the evidence that Safer at Home is working. And so we continue to work with models to help us understand worst case scenarios, to inform the strategies we need to put in place to help us, again, continue to make sure that these worst case scenarios don't happen. The modeling we've done most recently, which is also available on the website, was looking at the dates upon which you would stop Safer at Home and the subsequent surge that would happen as a result. And it outlines a number of scenarios, including one in which we continued Safer at Home and accelerated and built up our tracking, our contact tracing and testing capacity. And what that model showed us was that with vigorous testing and tracing, we will be able to stay below the capacity of our healthcare systems. And so that was a really important input in our decision to extend Safer at Home and to develop these plans through Badger Bounce Back to scale up testing to 85,000 tests a week and to hire 1,000 contact tracers, again, to help us really do that aggressive hand-to-hand combat on the ground to stop the spread of this disease on an ongoing basis when we have more interaction among people as we continue to turn the dial.
Thank you, Ben. Now to Jessica Van Egeren from Up North News. Jessica? Jessica Van Egeren? And a reminder, *6 to unmute your phones. Jessica? Okay, we'll move on then to Mason Dowling from WAOW-TV in Wausau. Mason? Mason Dowling from WAOW.
Hi, can you hear me now?
Yes,
Yep.
we can.
Okay, perfect. This question is for the governor. Governor Evers, yesterday there was the push from yourself, the DHS, and the Department of Justice to ask the Supreme Court to throw out that case, the Republican lawsuit against the extension over Safer at Home. What do you make of all of this becoming such a fuss being brought into the state Supreme Court?
Well, first of all, as I said initially, solving the political differences on this, frankly, we proposed Safer at Home, and the response was ending up in the Supreme Court. So I'm not sure that's the best way to solve problems. But I will say that we have a good case if we believe in the facts and we believe in the law and we believe in precedents, we should win. And so we're relatively hopeful that we can move beyond this and move forward as a state. It benefits nobody, frankly. And we've had good support, great amicus briefs by different groups of people across the state that understand the importance of Safe at Home, understand the importance of contact tracing, the importance of testing, and also the importance, as we are trying to do now, of turning the dial when we can to open up the economy. So we feel confident in what we're doing and in the lawsuit also.
Thank you, Mason. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hey, can you guys hear me?
Mm-hmm. Yes.
Thank you. So you guys have reported that hundreds of employees, I can't remember the exact number off the top of my head, have been transferred within Department of Workforce Development to help answer calls and on over the overloaded phone lines. What else are you guys doing to make sure unemployment is received in a timely fashion other than that switch over? I know that New York has set up an online system to deal with errors rather than having phone calls. Is anything like that planned here? Or what else is being done besides the new call center that's going to be up in a couple of weeks?
I think I gathered the question. So I think the question was asking what's being done at DWD in order to address the unprecedented number of claims that they filed. And as the reporter mentioned, DWD has been hiring, we've been transferring employees from other agencies to be able to fill in. DWD also did a significant technology upgrade to be able to handle a significantly larger number of callers.
We have been listening to Wisconsin Governor Tony Evers' update on the Wisconsin situation with COVID-19. Minnesota Governor Tim Walz is touring a meat processing plant today after several cases of the coronavirus impacted many of those types of operations in Minnesota and elsewhere. The Minnesota Department of Health is now getting ready to hold its daily update on the number of cases. Let's listen into that live now.
Start with an update on the COVID-19 outbreak from Minnesota Commissioner of Health Jan Malcolm and MDH Infectious Disease Director KRIS EHRESMANN. Following that, we will be hearing from Homeland Security and Emergency Management Director Joe Kelly and MDH Assistant Commissioner Marie Dotseth on today's announcement related to an alternative care site in Roseville. Then we will get an update from DEED Commissioner Steve Grove. Following Commissioner Grove, we will take questions from reporters, and at this point I will now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Thanks for joining us again today. I will once again just briefly run through the situation update from a numbers perspective and turn it over to KRIS EHRESMANN. Globally, as of early this morning, there were more than 3.1 million cases and 217,500 deaths around the world. The United States is now reporting over 1 million cases and 58,355 deaths. Here in Minnesota, we have now a total of 4,645 Minnesota laboratory-confirmed COVID-19 cases. This is up 465 from yesterday, another very significant increase, and again, driven by the focus in intensive testing, certainly in the southwest part of the state, but also reflective of the increased testing capacity in Minnesota and increasing volume of tests statewide. We also have an additional 18 fatalities to report today, to a new total of 319 deaths. And the pattern continues to be very similar in terms of the demographics of the deaths: 3 people in their 90s, 6 in their 80s, 5 in their 70s, 2 persons in their 60s, and 1 in their 50s, and actually one today, younger person with significant underlying health conditions in their 30s. And the majority of these deaths were in, and all of these deaths today or yesterday were in Hennepin and Ramsey County, so a metropolitan area, and the majority associated with long-term care. As of today, 2,043 patients have been released from isolation. There are currently 320 patients currently hospitalized, 119 in intensive care. So we've seen a fairly stable intensive care volume over the last number of days. With that, I'm going to pass it to KRIS EHRESMANN, our Director of Infectious Disease.
Thank you, Commissioner. I just wanted to comment on a couple of things. One is, as I mentioned yesterday, we are doing more testing, and we are seeing more cases. And so people should recognize that we are going to continue to see more cases as we're able to do more testing. And that is not necessarily a bad thing. That means that we are detecting cases, that we have the opportunity to identify contacts, to work with these people. But I just want people to know that we're going to continue to see more cases and continue to see, along with that, we will continue to see deaths. The other thing that I wanted to mention is, as we talked about earlier, a few weeks ago, a positive is that we have 215 long-term care facilities who have identified at least a single case in a resident, a staff person, or a contractor. But almost half of those, 93% of those facilities, have only a single case, and 31 have just 2 cases. So I want to acknowledge that while we're seeing, obviously we're seeing some situations in which there have been, multiple cases identified. That is not the case for every facility, and these facilities are doing a great job, and their staff are working very hard to care for the residents. So I wanted to acknowledge that. And then finally, we had gotten a question earlier in the week about our overall case fatality rate, that it appeared high, and we acknowledged that in part that was because we were focusing on a certain portion of the population. And I wanted to say again that as we're continuing to get more cases from a broad cross-section of the population, we are continuing to see that case fatality rate drop. So we went from 4.5 earlier in the week, and now today we're at 6.8. So as we continue to get test results from a more representative sample of our population, we're seeing that our case fatality rate is dropping, and it fits well with, or it will be fitting well with what we're seeing in other locations. And with that, I'll turn it over to Director Kelly.
Well, thank you, KRIS, and good afternoon, everyone. Today I am joined by Marie Dotseth, Assistant Commissioner with the Minnesota Department of Health. over the past month, a lot of really good work has been done at Minnesota's hospitals and healthcare facilities, and they have quickly expanded their capacity to care for patients during the anticipated peak of COVID-19. Arrangements have been made to more than double intensive care capacity and potentially add 1,800 beds in non-patient care areas at hospitals and other medical facilities. At the same time, our alternate care site team at State Emergency Operations Center developed a plan for setting up temporary healthcare facilities that are outside the existing hospitals. And these temporary facilities are where non-critical patients will be cared for so that we can free up space in the hospitals. As our medical director partner constantly reminds us, hospital patients belong in real hospitals. And that means that these community-based alternate care sites will only be used if there is no other options. So we hope we don't ever need to use them, but as we have said before, hope is not a plan, so that's why we developed a plan and are executing it to build out an alternate care site. The team assessed properties that were nominated by local communities around the state to determine their suitability for healthcare use, as well as their potential to serve as an alternate care site. And please remember, these sites are not intended for walk-up medical care, nor are they COVID treatment facilities. These alternate care sites will serve as hospital overflow facilities for patients who don't require a high level of care as they complete their convalescence. As the governor announced early today, we have entered into an agreement with Presbyterian Homes in Roseville to use one of their facilities as an alternate care site. The available building is a recently shuttered nursing home that will be relatively easy and inexpensive to prepare for the care of patients. And that facility has the capacity to handle up to, I think, 100 beds. We are very grateful for the partnership with Presbyterian Homes and their willingness to make one of their facilities available to us. The next step, which is going on as we speak, is for our construction consultants to complete their assessment of the facility, finalize their design plan or their remodeling plan, if you will, and then put their subcontractors to work on making the changes, improvements, and repairs. And we anticipate that the site will be physically prepared for operations in a couple of weeks. At the same time, we are ordering basic equipment and supplies needed to operate the facility and developing a staffing plan. So we look forward to completing the development of the Presbyterian Homes property as our first community alternate care site. So thank you, and I'm going to hand it off to Commissioner Steve Grove of the Department of Employment and Economic Development. Commissioner?
Thank you, Director Kelly. Good afternoon, everybody. We want to start off today with an update on pandemic unemployment insurance. And this is a program that expands through the federal government's CARES Act unemployment insurance benefits for individuals who are not usually covered by unemployment insurance. In particular, self-employed, independent contractors, others who didn't meet income thresholds in the past. An incredibly important program for those who wouldn't usually be covered. And a really complex program because so much of unemployment insurance is based on our ability to track your income over time and use traditional reporting mechanisms to pay people out what they deserve. So our team at the Department of Employment and Economic Development has been working day and night for the past few weeks on getting pandemic unemployment insurance up and running, and we were one of the first states in the country to do so late last week. So we have now put into play all three of the major unemployment insurance expansions that the CARES Act tackled, both pandemic unemployment insurance for the self-employed, the extension of 13 weeks to the program for all Minnesotans, and the $600 top-off of the program as well. So far on pandemic unemployment insurance, again, for independent contractors and self-employed, we've made about 40,000 people. We've been paying about 40,000 people who've applied. Every day we add new blocks of people to that system. It's complex given the challenges of determining income level, but a partnership with the Department of Revenue has really helped us get this right and ensure that we're tracking income effectively and really preventing fraud in this program that is really unprecedented in its scope and scale, but it's so important to get right. So that partnership has been really critical. Every day we're processing thousands more applications. I just wanted to give a few important updates that people should understand about this unique program. The first is that if you've already applied for unemployment insurance, you don't have to do anything new. We will automatically establish that benefit for you if you're eligible, and we'll proactively reach out. So if you've applied, don't worry, it's coming, and we're going to get you every single penny that you deserve. If you haven't applied for unemployment insurance benefits, go to UIMN.org, and there's some special instructions there on how the self-employed or 1099 workers can take advantage of unemployment insurance through this new program. So UIMN.org is the place to go. Please apply as soon as you possibly can. And if you've applied for them before without following those instructions, don't worry. You don't need to change anything. We're reviewing every account type to make sure that all those who are eligible get their funding. And again, we'll reach out proactively to get you there. So you don't have to call in for follow-up. We are tracking every single application, and we'll get you the benefits that you deserve. And I think it's also important to know that that $600 top-off also applies to this benefit. So if you're an independent contractor or self-employed, you also get that $600 top-off payment that came with the Federal CARES Act as well. So we're working hard on this. We are backdating every single payment to the moment that you are eligible. So you're not losing any money over time. For example, we've had 40,000 applicants, like I said, that we've paid so far, but we pay actually 87,000 weeks of pandemic unemployment insurance to those applicants. So we are backdating those payments and making sure that we get Minnesotans the money that they deserve. So an important benefit, a tricky one, but we are making it a top priority to get that out to Minnesotans as fast as possible, and are proud and grateful to be able to do so. We're just updating on our unemployment insurance numbers. Since March 16th, we're up to 564,690 applications for unemployment insurance in our state. This week so far, we've had 17,928 new applications come in. Total number, of course, continues to rise. We do continue to see a sustained downward trend in daily applications over the last few weeks. And our call numbers remain pretty high, about 5,000 calls a day. Wait times are around 1 hour. If you call and you're on hold for a while, just hang on. We'll get to your call, but it's going to take some time. And again, we really do appreciate people going to UIMN.org to begin their journey there. There's everything that you need to do, you can do online without having to pick up the phone. I wanted to turn back and talk a little bit about our work as it relates to safely returning to work. As you saw in the Governor's Executive Order 2040 last week, we've begun the process of building out the framework for how to get this right for businesses. And one of the key pieces of that is really effective and important health screenings for any business to use for workers who show up on site. And today, we're happy to announce two great new resources that will help Minnesota businesses and workers get that process right of getting health screenings in place that are really useful. The first is something called the Minnesota Symptom Screener. And this is a new tool that the Department of IT Services, MINIT, developed in partnership with Target and with the Minnesota Safety Council to create essentially a web-based tool to help organizations or business conduct those basic health screenings as required in EO 2040. So this technology tool allows businesses to log data from employees in terms of their temperature, their answer to basic screening questions, and in an anonymous way, aggregate that data over time to track the health of their workplace to ensure that it is a safe place to be. Again, all of the data is anonymous. It is optional to use for both the worker and the employer. It requires no personally identifiable information. It just requires people to share their health screening information and for that to be logged in the app. But it's a great free and voluntary resource for businesses and organizations to track this information over time in ways that are useful for the health of their workforce. So we're very excited for this new tool. Very grateful that Target and MINIT and the Minnesota Safety Council were able to partner together to make this. Again, just a good example of a Minnesota business, a nonprofit, and state government working together. I know in the first hours of today we've seen hundreds of businesses sign on and use that tool to ensure that they can get health screenings right. If you want to check it out, it's at mnsymptomscreener.minnesotasafetycouncil.org. That's mnsymptomscreener.minnesotasafetycouncil.org. We're excited about that and hope that many businesses and organizations take a look. The second announcement that we've made today was also a partnership with Target, who announced today that they're making no-touch infrared thermometers available to Minnesota businesses at wholesale cost through May 16th. This is really exciting news, really good news for businesses. We know so many businesses have been looking to find infrared thermometers, and some of those items that has gone on a shortage pretty quickly in this crisis. And Target moved quickly to procure more of those, and they've been kind enough to help Minnesota businesses get those thermometers at wholesale cost. So they've launched a special site for that. You can go to target.com if you have a business account and get to it. It's also on the DEED blog at mn.gov/DEED. And these thermometers at wholesale cost are going to be helpful for those screenings. And again, temperature checks are not required. They are highly recommended practice, but we wanted to highlight this given their importance in the health screening component of this. And I think as we continue to listen to businesses and labor groups and workers from across Minnesota about how to safely return to work, tools like this, health screening, thermometers, digital tools like these are just really important to making sure we get it right. So big thanks to the Minute, Target, and Minnesota Safety Council for those new developments on our work to get people safely returning to work. And of course, we are actively discussing and engaging with business leaders and labor leaders across the state on the next steps for safely returning to work. We've seen this week, as of Monday, many businesses were back to work under Executive Order 2040 in manufacturing and industrial settings, those more predictable settings where COVID-19 preparedness plans can make sure we get the safety for workers right. That EO is just the first step in the dial the governor walked through last week of slowly turning the dial up to how people can get back to work and do so in a safe and productive manner. And it's going to be some time before we're fully returning to anything compared to normal, but at each step of this journey, we need to make sure we're giving the right planning guidance and working very, very closely with business and with labor and workers to navigate these steps forward. So we're going to have some additional announcements on this tomorrow. The press conference, Governor Walz will walk through some additional announcements as it relates to the stay-at-home order that I think would be valuable to see. But just wanted Minnesota to know that we are thoughtfully working on this with both business and health experts to chart the course that makes sense for our state. And then lastly, I wanted to end with a nice story of a business in Minnesota that has really stepped up to help in this time of need. Michael's Foods over in Gaylord has been giving away food to food shelves for many, many years, but given the developments of COVID-19 and the fact that they were facing kind of an oversupply of product because of the slowdown in the food service industry, they found a new way to give back to the community. Every day now, during a 3-hour window, cars line up for blocks around Michael's while their employees and volunteers wearing masks and gloves put 40-pound containers of food into each vehicle. They've given away 396,000 pounds of food so far. Michael's Food, just a great employer there in Gaylord Amblesore, 700 people working there, and this step allows those workers to give back to their community in, I think, a really powerful way. So we remain grateful and inspired by Minnesota's business community across the state stepping up in this time of need. With that, I'm going to turn it back to Mike as we take your questions. Thank you, Commissioner Grove. We'll open it up for questions now, and as we do, I'll just ask reporters to limit questions to one primary question and one on-topic follow-up, and that we limit questions.
Well, you've been watching the Minnesota Department of Health's COVID briefing, and we'll be continuing to track. But, when we started these briefings, there was a sense of shutting down. Today's briefings, both from the Wisconsin governor and for the Minnesota state health officials, there's a palpable sense of progress moving forward, whether it be testing and tracking, opening up new ICU facilities, and getting ready for yet a potential surge of cases on the medical side. Joe Kelly, the emergency management plan, offered information about that, saying they've even repurposed a long-term care facility to help care for more patients. And then wrapping up with the economics of the comeback, the DEED commissioner talking about if you applied for unemployment and you're eligible, you will get benefits, although the backlog is slowing things down. And ending also with a Minnesota symptom screener. That's a brand new tool for businesses who are hoping to get back to business and doing it in a safe safe way for their employees. So clearly a palpable sense of progress being made, a sense of looking forward now. We'll continue to track developments all this afternoon and bring you updates, of course, as they happen on WDIO's website and mobile app. And we'll also bring you the latest on WDIO News at 5.
This has been a WDIO News special report.